Hello everyone, my name is Lucy. Today I want us to talk about something that is very important, and this is known as ectopic pregnancy. This has claimed many pregnant women's life. That's why I find it necessary to discuss it today. Ectopic pregnancy is when the fertilized ovum attached or embedded outside the uterus. On a normal, after fertilization, the fertilized ovum need to move to the uterus in order for it to continue its journey there. But when it fails to move to the uterus, it is either it embeds in the fallopian tube or in the cervix, or rarely in the abdominal wall. When this occurs, it is known as ectopic pregnancy, and it is very deadly. The only way that you can avoid the danger that comes with it is if you are able to detect it early. So if you are pregnant, how are you even going to know if you are having ectopic pregnancy? One, there are signs that comes with it, whereas in some cases you might not see any sign. If you are pregnant or you are not aware you are pregnant but you have missed your period, or you are having abdominal pain, severe lower abdominal pain, or you are having vaginal bleeding, some comes with dizziness, please rush to the hospital so that you will be diagnosed on what is wrong. I always advocate for early antenatal. If you have missed your period, it is mandatory that you go for scan, even if no healthcare provider have required you to do that. When you go for scan, if there is no pregnancy in the uterine cavity, they might as well dictate if you are pregnant but it is ectopic. And this ectopic kills, especially when it has ruptured. It kills. If an emergency measures are not carried out immediately, that person and that baby's life will come to an end. So if you notice these signs that I have mentioned and you don't notice any sign but you are aware you've taken in, please go to the hospital, carry out some tests. There are some that healthcare provider need to send you before you can go for them, and there are some that you can do by yourself, especially ultrasound scan. Early ultrasound scan always dictate ectopic pregnancy before it ruptures. If you have an ectopic pregnancy and it did not rupture, you are able to detect it on time, there are some drugs that you can receive from your healthcare provider that will make the tissue to stop growing. Because irrespective of wherever that fertilized ovum has embedded, it will continue to grow. But because outside the uterus that expands to accommodate the size of the baby, all other places doesn't do that. So if the fertilized ovum is growing and the place it has embedded is not expanding, it will rupture, and when it ruptures, bleeding will set in. It is more life-threatening when it has ruptured. So if you're able to detect it on time, you can go to your healthcare provider so that they can continue with the medical management. But if it has ruptured, it is an emergency situation that requires them taking you to theater to do laparotomy. This ectopic pregnancy kills, but if you are able to detect it on time, you are going to save lives more. And there are people that are at risk of this ectopic pregnancy. One is, if you had this ectopic pregnancy before, in your previous pregnancy, if you take in again, please pay that attention to your body. Be very careful, because there are possibilities that are going to occur, and again, once you have had it before. Secondly, if you took in through IVF, there is chances of ectopic pregnancy. If you have untreated infection and you take in, you are at risk of having it. Then, if you had infertility before taking in, there is high risk of having ectopic pregnancy. Or your choice of family planning is IUCD. These are risk factors. Does not necessarily mean that if you've done all this, you must have ectopic pregnancy. But these are things that predispose you to having ectopic pregnancy. So, but what I want to pass through today is this. Once you take in, rush to the hospital and carry out an ultrasound scan, even without being sent by any healthcare provider, so as to ascertain that you're not having ectopic pregnancy. Once it ruptures, if there is no immediate intervention, that person and their baby is going, and there's nothing that can be done about it. The medical management is just to stop the tissue from the fertilizer from growing. It will stop growing and the body will naturally absorb it. But if it has ruptured, it is always immediate intervention to save the life of the mother. Thank you so much, and if this video have helped you in any way, please do not fail to show that it has by subscribing, liking and sharing the video. Thank you for watching, and goodbye.